The value of patient autonomy in medical ethics. Ethical considerations in regard to patient autonomy. Patient's autonomy is one of the crucial foundations of medical ethics. While it is necessary for the nurses to respect the patient's decisions during treatment, their views on the patient's autonomy often differ. The International Medical Association believes that patients have the freedom to obtain essential medical data and even the freedom to choose the appropriate treatment. Nurses are accountable for valuing the patient's autonomy in the process of improving their health condition. However, there are cases in which the nurses may violate this fundamental requirement. Thus, the nurses need to balance the patient's choices and the right decisions. Providing information about the illness and getting the patient involved in the process of planning are the preeminent principles of proper respect for the patient's autonomy. Research by Rahmani shows that there are considerable differences in the ways nurses and patients see their attitudes towards autonomy. While medical staff believe that they value the patient's freedom, the latter tend to consider their freedoms violated. The most common complaint on the part of the patients is that the nurses do not provide them with the whole amount of information about their health condition. Additionally, patients feel that they are not entirely involved in the procedure of making a resolution. Based on a number of studies, Rahmani concludes that the notion of autonomy is culture-related. He also remarks that the health condition of the person is closely connected with their opinion about the nurse's respect towards their rights. For instance, Rahmani mentions that the worsening of the patient's state leads to a better opinion about the nurses conforming to the autonomy standards. The more time the nurse spends cooperating with the patient, the more trust on the patient's behalf appears. The autonomy model of treatment is manifested via the juridical principle of informed agreement. This policy became possible due to a proposal made by philosophy and legislation activists who proclaimed a fundamental value of the patient's resolution-making ability. Therefore, a medical worker has to get the person's consent before starting the therapy. If the patient refuses to give their consent, it may lead to a worsening of their health condition or even result in death. In such a situation, medical workers face difficulty regarding their primary duty of applying their abilities to pursue the best outcomes for the patient. The principle of autonomy in nursing. Ethical issues faced by nurses are numerous, but the most challenging one takes place when the patient's autonomous decision conflicts with the doctor's advice, which aims at looking out for the patient's best interests. The so-called beneficence model dates back to the times of Hippocrates. According to this model, doctors have an ethical duty to do everything possible for the welfare of their patients. Thus, the doctors used to be accountable for the proper behavior. They had to decide what was best for the patients. Such norms created a situation of benevolent deception. The doctor has to conceal the facts which might impact the patient's attitude towards their state and treatment. The problem is that nowadays many doctors would like to conform to the beneficence model, while patients want to take part in their fate. Under these circumstances, nurses meet with the difficulty of being between the two opposing sides. Medical ethics in such a situation play a bad joke on the nurse, who naturally has to take the best care of the patient but at the same time wishes to stay on good terms with a doctor. A good way to solve the nurse's problem is the new method of patient autonomy. According to this approach, the doctor has to provide the person with all the information regarding their illness and ask for the person's consent before choosing the treatment measures. Patient's autonomy derived from the bioethics movement, which was closely connected to the civil rights movement. While patient's autonomy sounds like a good and fair idea, it still leaves many questions to consider both for doctors and nurses. For instance, there are medical states which do not allow a person to make a sensible decision. Also, sometimes patients' resolutions contradict the law on non-maleficence, leaving the medical workers in a problematic situation where they have to choose between the patient's welfare and their consent. The nurse has to meet several requirements in the situation of patient-doctor relationships under the circumstances of the autonomy principle. First of all, nurses need to observe the rules of benevolence and non-maleficence. Also, nurses should be fair and loyal to their patients. The principles of paternalism and integrity are also decisive in the nurse's profession. Therefore, when deciding on whose side to take in the conflict of interests under the autonomy principle, the nurse needs to consider the patient's welfare first of all.